So when glucose can't move in and out of cells, it stays in the blood, and that's what they call diabetes. So when they measure, oh, you have high blood sugar, that's technically what diabetes is. And there's two types, but the bad part is glucose will harm the tissue, liver, kidneys, your cells, your feet, your eyes, causes a lot of problems if it stays high. So we want to always be addressing this, because what's out there now, food-wise, a lot more choices than there used to be, a lot more junky choices. So type 1, this is basically where your body stops producing insulin. So your pancreas says, nah, I'm tired, or something happened to it, or maybe you had some alcohol damage or trauma. There's, I read recently, trauma-related type 1 diabetes, where somebody had some sort of trauma, like a car accident or a fall from a high building, and they damaged themselves, so now the pancreas stopped working. EMF radiation, these things, we just got these cell phone EMF blockers. A lot of research in Europe, doesn't matter here, but in Europe there's 19 documented cases that cell phones, those things, cause cancer. But not here in the US, because everything's clean in the US. But outside the US, they banned microwaves in Europe, so but we still have them here. So, I don't know, EMF damage. Treatment usually is required daily for people who have type 1. I have a patient who actually, she's been type 1 diabetes for 20 years. She started getting adjusted, her insulin requirements went down 80%. And her endocrinologist said there's no connection between this chiropractic and reduction of insulin. And so she actually, since she's been a patient of mine for 6 months, she's gone through 3 medical doctors. She fired them all. You're fired, you're fired. And the doctor would say, why did you spike? Because she has an insulin pump and it can read. She's like, why did your blood sugar spike here? She's like, that's when I get adjusted. And he's like, that's impossible. She's like, it does it every week at the same time. So there's a connection there between the adjustment and how the pancreas works. So type 2, I usually say this is fork induced. So what you put on your fork creates type 2 diabetes. So this is somebody who's unable to use the insulin, and they're insulin resistant. And most diabetics are type 2. That's the majority of diabetics. You usually see this later in life. Like you're more susceptible in your 40s, and then as you go into your 50s and 60s, 65, you get more susceptible to becoming a type 2 diabetic. And it's easily controlled through these things: diet, losing weight, exercising, and chiropractic care. This guy I was telling you about, that he's a big bodybuilder. He's training this lady over at the gym. I see him all the time. And she's obese, and she's a type 1 diabetic. She's insulin dependent. And he said, we pretty much got her off all of her insulin just by working out. She won't change her diet, but through the workout that she's doing, they work her tail feathers off. But she's basically reversed her type 1 diabetes just by exercise. Imagine if you combine all these other things in there. Change the diet, right? Lose some weight, which she's doing, but throwing some chiropractic in there. So all these things help. It's not just one thing. But big in diabetes is diet, especially type 2. Complications, lots of issues related to high levels of blood sugar. I always remember Santa Claus. What do you always leave him? Cookies and milk, right? Isn't that amazing? He goes to all these houses and the guy still has his legs, still has perfect eyesight, right? Normally they're going blind and they're losing limbs. I know, but that's the metaphor. Santa Claus should be losing a leg and a limb, and because of the complications with all the sugar that he's eating, even though he's a little overweight. But high blood pressure, cholesterol issues, stomach issues. I know a guy who had his foot amputated because of diabetes, didn't take care of himself. So your extremities start to die, basically. Risk factors: type 2 diabetics have the following: blood pressure issues, triglyceride issues, nerve system damage, sedentary lifestyle. These are all associated with type 2 diabetes. So the more we can get out there and move, the better off we're going to be.